I am Dana Hall, and my business is Red-Headed Farrier. You can find me online on social media at Red-Headed Farrier, redheadedfarrier.com, hashtag Red-Headed Farrier, any of those things. Other farriers actually named me that when they didn't know my name when I was first starting, because, you know, the Red-Headed Farrier. So that's me. Thank you for joining me today. I like to start with my education. Sort of where I came from, how I started. I went to Michigan State University, graduated with a degree in business, and I went to Mission Farrier School out in Washington. They're now located in Oregon. And I also went to Heartland Horseshoeing's blacksmithing course as well. So I have certifications through the Equine Lameness Prevention Organization for live sole hoof mapping, barefoot trimming, their farrier certification. And I also am associated with the International Association of Professional Farriers, the IAPF. I like that one because their accreditations are based on continuing education and not necessarily passing tests and certifications. So they really encourage people to continue their education. My personal hobbies, I started with dressage at a very young age, but I am a cowgirl at heart and now a longtime barrel racer and cowboy mounted shooter. And I also like to start out with, down here, bad things that people like to say about me. Other farriers, trainers, horse owners, some veterinarians, farriers are sort of famous for not being nice to each other. And a couple of the things that they like to say about me is that I cut the toes off and put shoes on that are too small. So there is going to be more on this later. Basically, throughout this presentation, I'm going to explain to you exactly why I do the things I do and how I do it. So that said, I'm in an office, so if the phone rings, they have other business going on, so I appreciate your patience with it. So included in today's discussion, we're going to evaluate hoof health, and that's going to include footfalls, live sole hoof mapping, distortion, the sole plane breakover, and load sharing, the importance of the trim and why saving heel is not the answer, outward indicators of negative angles, which some people often, you hear it called NPA or caudal failure, and how NPA presents itself, affects lameness and performance, and ways to help. This can be on the hind end or the front end, even though it's more commonly presented on the hind end. And shoeing considerations in today's world, professionals and do-it-yourself. So footfalls, basically how the hoof engages the ground. Heel first, flat, or toe first landing. We'll start with heel first. This is actually me on my mare Millie. She's the reason I became a farrier. And we can see here we have a very large toe flip while running that's going to engage the ground heel first. Generally speaking, the longer the stride, the sounder the horse. It's just like us. If something's hurting, we shorten our stride and land toe first, basically. A heel first landing indicates a relaxed flexor tendon, and so less tension on the flexor tendon. The front half of the foot is bony, and the caudal or back half of the foot is soft tissue, tendons, ligaments, cartilage, extensive venous network, nerves, the sensitive frog, and the digital cushion. So basically, the back half is soft, the front half is bony. A healthy hoof, the back half engages the ground, the load is sent up through the frog and the digital cushion, supporting the entire bony column, and specifically lifts and supports the coffin joint and the navicular bone up and forward within the hoof capsule. This is very, very important towards healthy hoof function. It unloads the impar ligament, which 70% of the blood flow in the foot goes through the impar ligament, and the digital flexor tendon. It increases blood flow and dissipates concussion. A flat and a toe first landings, generally speaking, no bueno. Flat landings, while it's not the best, it's not the worst. And my discussion today, these are guidelines, and in some scenarios, a flat landing might be the best thing that we can get, or it depends. Me personally, I always try to achieve. I shoe and approach it as if I can make a difference, but I don't make false promises to people. So, toe first landings are not beneficial at all. They are harmful. They drive the force down through the bony column, the coffin joint, and onto the deep digital flexor tendon and the navicular region and the impar ligament. I included these two are the same photos, top and bottom, but I drew on the bottom ones. This one I had trimmed on the right. I had not trimmed that yet. So you can see this horse had a tremendous amount of saved heel, and there's a big gap between the frog. So when this horse engaged the ground, either standing or in motion, you can see we would have the heel first landing here, which would put the impact through the back half of the foot and dissipate the concussion up through and pick everything up from the back. This foot here engages the ground toe first, which sends all the stress down through the joint onto the navicular region and the flexor tendon. A healthy back half of the foot is essential for overall healthy hoof function. The basics of hoof mapping, which is one of the things I'm certified in, it is why I chose the school that I chose, Mission Farrier. The testing and the certification I did through the Equine Lameness Prevention Organization. And here I have listed, they're actually probably not in the best order, but is 3 ways to find the center or the widest part of the hoof. 1 inch behind the true apex of the frog, which I'll discuss the true apex here in a moment. The true apex of the frog, because sometimes the frog will lie to you. 1 inch behind that. The second is where the bars of the foot end and the commissures tighten. The widest part of the sole wall junction, which is the white line and not the widest part of the hoof wall. The hoof wall can distort around the rest of it. 2 ways to find the true apex of the frog is where the frog tissue changes to sole tissue. So we can take our knife, lift up the tip of the frog, and cut a little bit off, make a half circle around the tip of that frog. It'll give you an indication of how much sole depth there is and where the actual tissue changes. We can also take double the length of the central sulcus. I tend to use that one to confirm, once I've trimmed the front of the frog, I use that to confirm. You double that central sulcus and a lot of times, boom, it lands right on it. So, 2 ways to find the farthest back base of support at the frog buttress. There's a dimple on the back of the frog at the central sulcus, at the back of it, and where the frog and the heels meet, both medial and lateral, both on the inside and the outside. The tip of the coffin bone is, generally speaking, 3/4 of an inch in front of the true apex of the frog. And breakover is ideally 1/4 of an inch in front of the tip of the coffin bone. I have a front foot on the left side and a hind foot on the right side. The tip of this frog is about here. Breakover on this shoe started way out here. This shoe here, an Avanti, breakover actually starts at the first nail hole. So this shoe actually provides breakover relief in forward motion and medial laterally. There's a rail right here. Hind one, the tip of the frog is about here. Breakover started way farther out front. This one, the ultra hind here, the shoe starts to roll a little bit around the first nail hole. We can also see, looking at these, we have forward motion or forward growth of the heels. Obviously the horse was due. And back here, we brought it back to the dimple and where the heels meet the frog. Same thing on this side. We've grown forward, and then we've brought that base of support all the way to the back of the foot. I want to make a note on this first. The left photo, this foot was shod 2 to 3 weeks prior from when I saw it. The right-hand photo is after my shoeing. The back half of this foot is very robust. We can see it has a really thick digital cushion. But the heels, when we look here, the heels were saved or stacked up. If if there were actually people sitting in the room, which there were when I originally did this presentation, I said, can anyone guess what kind of foot this is? And this is a more upright angle foot. Not necessarily a club, but definitely a more upright foot. It is one of the only kinds of feet where the heels actually grow vertically. Because when we talk about heels, and a lot of people want to save heels, I've found this is a lot of misunderstanding. Most of the time, heels grow forward. The foot grows forward. It does not grow vertically. In this case, the heels have actually grown vertically. It starts with the trim. I say this all the time. I say this in most of the things I post online. The photo on the left, we see, as I've already discussed, saved heel, and this was a flat perimeter fit shoe. The frog cannot interact with the ground, so we see heels that were stacked up and then a shoe placed on top of it, so we have a gap between the frog and the ground. This scenario creates a toe first landing, which causes subluxation of the joint. So basically, in plain terms, we engage toe first, it breaks back, that joint stresses backwards, stress on the flexor tendon and the navicular region, driving the force down through the bony column. It also beats up the tip of the coffin bone, which can potentially create mechanical laminitis. I actually have some photos of this in future slides here. Afterwards, in the photo on the right, the shoe heels are softened to encourage a heel first landing. These shoes actually come this way. Sometimes I grind even more away. The heels are trimmed so the frog can engage with the ground. So the trim that I do is very different if I'm going to put a shoe on it than it is if it's going to stay barefoot. Basically, when we place the shoe, we still see we can have some contact with the frog, even with a shoe on it. We share the load across the back of the foot, all of which lifts the coffin joint up and forward, supporting the joint and relieving the navicular region and the flexor tendon. Here's me. This is a little bit older photo. This is Millie. She is the reason I'm a farrier. And these are her x-rays. I do want to make a note. This is all the same foot. These x-rays were not taken the time of the shoeing, so these don't reflect that. What I have notes here to take notice of is the dorsal dish, which she has her little slipper foot, and also she has a dish in the coffin bone. Okay. Before and after, the balance parameters are around the center of rotation. So one of the things, this one is a right front. Dr. Mansman, this was when, for 5 years before I became a farrier, I held 3 hours each direction to have my shoeing done with a vet and farrier with Dr. Mansman in Chapel Hill. So we'd drawn a line here at the time, it's funny, I didn't know then, but to de-rotate this foot. So ultimately, Millie is a 15 one-hand quarter horse with triple lot or double lot feet. They're very small, and they're also more upright. So she was sort of the victim of a mismanaged upright foot, toe first landing. This curl in the coffin bone is from repeated abuse of toe first landings and pounding basically the front half of that foot. As opposed to, so this is your example of mechanical laminitis, as opposed to eating too much grass and getting laminitis. This is the left front. Not sure if you can see it on here, but the tip of this bone actually broke off. You can see it floating in there. We also can see here, here's the tip of her bone, breakovers way out in front of this foot. This is the shoeing afterwards, and this is the map that I have drawn, and you can see the toe that I have yet to remove, basically. So when I was talking about the mapping, we have 1 inch behind the true apex of the frog. I drew a line on the bars where the bars came to an end and the commissures tightened. In this case, it happened to line up. Breakover was, you cannot see it now, the tip of the coffin and breakover. And then I placed the shoe to bring the support back to the widest part of the foot. To the widest part of the frog. And then we bevel the toe, so as the horse is in motion, the shoe rolls and the toe bevels and it unloads everything. and helps them with forward motion, reducing leverage and tendon tension. Okay, hoof mapping and the live sole. Basically, growth is distortion. I like to tell people, just because it grows there doesn't mean that you go there with the shoe. So if we have a scenario where the foot gets trimmed and there's a misconception about no foot, no horse equals bigger is better, when actually bigger can mean leverage. So we don't always necessarily go there and keep making the size of the shoe bigger and bigger and bigger. As I previously said, most hooves grow forward, not vertical. So saving heel is not the answer. With this foot here, these are actually two different feet. This is a hind. This red line here represents the farthest back base of support on the foot, the estimated center of rotation. The green line is where breakover wants to be, and the red line is where breakover was at the time. Afterwards, we can see I've brought the shoe farther back, center of rotation, breakover, we have 50-50 instead of 60% in front and 40% back. So as a general guideline, I try for 50-50 around the center of rotation, although I will say on the hinds, I personally believe, everyone has opinions, that they do need a little bit more toe. So once I get the foot under control and not distorting all over the place, I may give them a little bit more depending on what the horse's job is. We need toe to run, turn, jump, things like that. So I'd like to also state that hoof pastern axis alignment is desirable, but sculpting the sole and the wall to achieve a specific angle can be detrimental. Each foot is an individual every time, and the mapping honestly allows me to look at that foot every time. And whether I draw the lines on the foot or not, I can't unsee the map. I always see it whether I make lines on the foot. So equilibrium around the center of rotation supports healthy hoof function for each foot. So I guess my point with some of this is, and I believe I say it in another one here or soon, saying that every horse needs to be 52 degrees is sort of the equivalent of saying every human should have a size 8 shoe. This doesn't really work. The live sole plane is a reliable representation of the coffin bone plane. Typically, they mirror each other. Exfoliating sole is dead, chalky, and flaky. Live sole is waxy and shiny. So for your most accurate measurements, that's why it's referred to as a live sole hoof mapping, because that is our most accurate way of finding the outward indicators on the bottom of the foot to locate internal structures. Sensitive sole would be one layer lower. We don't really want to go there because it bleeds. The live sole plane can be used as a reference for medial lateral balance. I have a couple phrases that I say all the time. In this particular case, balance is not necessarily level, and level is not necessarily balance, especially if the limb is crooked. So we can see in this one, we have a shorter wall here, and we have a really shoved up coronary band and long length of wall here. This is post shoeing on this one. This horse also has negative angles. I have the arc, and again, this is coming up as well here shortly. I have marked where the heel was hanging out and back. This was the last point of support. Estimate of center of rotation, breakover was way out in front. This horse he pointed this foot out chronically. He could not actually stand square. You can see the other foot here, and here he's able to actually stand square. I believe some of that was length of toe, but I also, in my heart, believe that was a big imbalance medial laterally. So ultimately with that, if the horse is crooked, and we just come along and make that foot flat, one side is over trimmed and one side is under trimmed. So actually sometimes we need to make them unlevel in order to balance them. It's one of the harder things to explain, especially here where I can't show you a foot. A little bit more on the mapping. There is no magical angle for every foot. There's no magical trim or shoe either. The mapping is a wonderful way to have guidelines when you don't have x-rays. Forcing every horse to be 52 degrees, like I said, is like forcing every single person to wear the same size shoe. My general goals are 50-50 around the center of rotation. This may vary depending on soundness and conformation. If I have a horse that's really, really lame and they have negative angles, that horse might be 40% in front and 60% behind when I'm done. It just depends. The long toe or low heel or run forward foot, that means that there's leverage. That equals tendon strain. And I usually, as a visualization, I ask clients to, okay, well, we're asking the horse to run and jump basically with swim fins or snowshoes on. This foot here, the heel had grown all the way forward, so this red line is where the farthest back point of weight bearing was. Estimated center of rotation, red line at the toe was where breakover was at the time. Post trim, I don't think I was all the way done with this one. And we can also see too, as a side note, thrush, not always environmentally based. Wet feet, it plays a role, but if the foot is dysfunctional, thrush is one of the things that will happen. So here we're much closer. I mean, we have like 80-20. Here we're much closer to our 50-50 parameters. This foot, I drew the lines. I have my estimated, I even put the dot in so people can see this is about what it would look like if we could see the coffin bone, and where we want breakover, about 1/4 of an inch, and then how I use those lines to place the shoe. And that's how I know to remove the toe and not shoe out and around that. Breakover is the pivot point for forward motion. In people, that's the ball of our foot. Sole depth is the limiting factor in being able to meet these balance parameters on a barefoot trim. So when people ask me if the horse can go barefoot, sole depth is the limiting factor. Well, there's more, but on the foot itself, not environmental factor. I had a field day with my coloring on this one. Blue line at the back is how far back we want the support ideally. The red line is where the support is, the farthest back point. Estimated center of rotation, coffin bone, estimated breakover, where breakover actually was. So center of rotation forward, at best we're 60-40 and we don't have the support back here that the foot needs. This is where caudal failure starts, the back half of the foot starts falling through the shoe. I also like to point out, please don't get hung up on a shoe. That's another thing farriers love to do. This shoe's bad, this one's good, blah, blah, blah. They're all shoes. All manufacturers make a breakover shoe. Or your farrier can make it if they're super handy and forged. Heck, you don't even have to be super handy. I happen to choose the shoes that I choose because of how I can manipulate them. And I operate in a very work smarter, not harder fashion. I also tell people the hardest thing about mapping feet is drawing a straight line. So here we have the base of support brought all the way back. Approximate center, crooked rotation, and a crooked approximate breakover line in the shoe. It starts at the first nail hole on this foot. Okay, so we have very clearly 50-50. Alignment, going back to that, with the hoof mapping, a lot of times if you have mismatched feet, or not mismatched in this case, I don't try to force a specific angle. I map around the center of rotation, and a lot of times as time goes on, the feet start to actually look more alike without me even trying to. This is just before and afters of one front and one hind. We see this horse had a lot of saved foot. There was a lot of foot to come off. very long dorsal wall, angle of the coronary band. And we also see differences in, and this is too, when we're talking about the alignment's much better without me putting a protractor on there and saying I want 52 degrees, basically. So, make sure. How does your horse stand voluntarily? Because what they do on their own is they're trying to communicate with you. This horse here, this isn't the most severe I've seen this, but she's standing like a goat on the rock first. After, she's much more able to stand square. In this photo, I actually only had removed, nope, because I had already removed them here. So I had trimmed the hinds and I had not removed the fronts. So how they stand on their own tells you a lot. Do they struggle to stand square? Do they point one leg? Do they point opposite legs? Do they stand like a goat on a rock or camped under, which is what this previous photo was? Can they stand on one hind leg easily with the other one in the cradle for the farrier? This particular example, again, it was pre and post shoeing. This horse could not, it was so tight on the hind end, it could not spread its feet apart. Negative palmar or plantar angles, depending on if it's the front or the back, and how they present themselves. This is the horse that was so camped under before. You have a long dorsal dome, a dorsal dome and a long dorsal length from the coronary band. Here's your dome, and a long length to the toe, and a steep coronary band angle. Afterwards, they're able to stand square, less dome, and a shorter dorsal length. So a lot of times when owners find me, I get told things like, I've had the saddle fitter out, I've had the stifles injected, the hocks injected, the SI injected, the body worker was here. It's not working, the horse is still lame, I don't understand. And typically my question is, when I look at the feet, has anyone ever mentioned that he has neutral or negative angles? Neutral being 0 palmar angle, negative being -1 in farm. Having the injections and different things like that, this is a classic case of treating the symptoms, and that's why it's not, you don't see improvement, or you see it only short term and then it returns back. So this, I want to say first, he stepped on himself, the blood was not me. He stepped on himself getting out of the trailer. This foot was long overdue, obviously, but it was a beautiful example of the outward indicators for a negative angle. So ideally, when I talk about the coronary band angle, you can see here I've drawn a red arrow. And this one was pointing at the elbow, armpit, almost to the belly. Some of them will point even more so than this, to the belly. The steeper the angle of the coronary band, the more negative the angle is. So meaning if that coffin bone is sitting in there, I'm not sure if you can see, but the more it points up, the more that coffin bone tips back. This big dome is another indicator, and usually it's accompanied by a very long length of this being the dorsal wall of the hoof. It mimics the plane of the coffin bone. So again, with the example, if this is the coffin bone, we can see why that would dome out as my hand pushes, right? If that coffin bone pushes. They appear to sit on their heel bulbs or have no heel. They stand like a goat on a rock. Or you'll see the hoof capsule that has rings that arc down toward the heel bulbs on each side. So you'll see these rings that come back. It's caudal failure. And we can see the difference. Just the difference in the coronary band, where it's pointing, the length of the dorsal wall. A little bit more able to stand square after I was done. So this is sort of my confirmation when I'm looking at a horse before I've picked a foot up. This picture was actually really hard to get to focus where I want it. But when I pick up the bottom of the foot and I'm thinking, no, this one's got negative angles. On the bottom side, we can see here, see the frog and see the tip of the frog, and sole. So a negative angle foot, if I have the palm is the bottom of the foot, as they grow through the cycle, they grow like this. So you'll see that frog point into the sole as opposed to being on the same plane. The heels are crushed, non-existent, flat, or run forward. A lot of times the frog is really big because it's trying to compensate for not having heels. Yeah, and this big spot here is me describing what I was talking about there. That is a little bit more science-y, as I call it, the frog plane and the sole plane and how they're sitting and working together or not working together. But it's very important for farriers, actually. These really negative guys, as they grow more and more, the longer they're that way, it can actually change the vasculature and the blood vessels. So it can lie to you, and you can look like you have a lot of sole depth. And then as you rasp or trim, you can get blood a lot sooner than you expect to. It starts with the trim. I mention it all the time. So NPA, negative angles in motion. Does your horse crossfire? Do they have trouble picking up their leads? Is their back sore? Do they drag their toes? Are they struggling to collect? Are they hollowed out with their head up? Are they bowing out on a barrel, struggling to sit in a turn, jump, slide, anything like that? Kissing spine has been shown to correlate with negative angles, and many times they get diagnosed with kissing spine, sore hocks, sore cycles, when really the negative angles need to be addressed. For discussion, Frank Sinatra. He and his owner has been a client of mine for a long time. This is his left front before. Now this x-ray was taken about 7 to 10 days. She hauls to me from Pennsylvania down to Virginia, and actually used to haul all the way to North Carolina. These photos, we have pre-shoeing and post-shoeing. We see here, this would be an example more of your flat or neutral angle. And I've dropped a line on the x-ray for the center of rotation, so we can see he's about 60-40. This horse is sensitive, so, and it's interesting, you know, some of them may not look too bad, or may look normal because that's what people are used to seeing. He presented with needing hock injections with increasing frequency. Then they stopped working as well. He had a very shortened stride on the hind end with extreme toe stabbing on all four and toe stabbing and extensive toe dragging on the hind end. Long drags, very sore on the hind end. As it turned out, when she got the x-rays, he was -8 and -6 on both hind feet. And here we have pre and post shoe. When Frank first came to me, this is years ago now, he was so sore he could not stand on one hind foot. And the farrier was having the vet out for every appointment to sedate him. And he was sent to us for training because she didn't want to continue to have to drug him every 6 weeks, 5 or 6 weeks. He physically couldn't do it. And the first time, it took us about a month actually to be able to actually get the shoes off the hind end. He was so sore. This picture though is right front. So he does have a little bit of mismatched front feet. Again, 60-40 at best, before and after. Oops, not too fast. This is the right hind lateral. Melissa did trace back her records, and unfortunately he started needing the hock injections not long after she stopped hauling down, but it's a long way to go. So you do the best you can. So I tell people want to beat themselves up, but you do the best you can with what you know at the time. So, and here we have right hind before and right hind after. really steep coronary band angle. So the shoeing package, DP is dorso-palmar, toe to heel, medial lateral leverage reduction, the rail on the shoe. I want to point out, breakover starts here. His breakover was out here before. This was a brand new unshaped shoe, but it gives an idea of how much I reduced the leverage of the toe. The hind shoeing, again, we can see, and I placed it as best I could, but much, much smaller shoe. He had a lot of support, but not a lot of leverage reduction. And some may say I took away too much support. I chose these shoes because there was a lot of nail hole choices. Aluminum wears in the way that the horse is going, but also this horse has pretty small feet. He's a little quarter horse, and he's a little thin-walled, and he's sensitive, and so we use little tiny nails because it's a little bit like holding your breath trying to drive nails. So hooves for thought, this is something I do on my Facebook page. I do Red-Headed Farriers hooves for thought. So support when static, or when the horse is standing still, can become leverage in motion. I'd like you to wrap your mind around that a little bit. It goes along with this idea that bigger is better. No foot, no horse, bigger is better. They're not the same thing. And if we put these huge horse shoes on some of these horses, when they start to move and work, it actually can create drag and make it harder for them to get up underneath themselves so the hop can function the way it's supposed to. So the thought is support when they're standing still is a little bit different when the horse is in motion, okay? It can actually create leverage and create stress. The next up for discussion is Jenny. She is NPA on all four, severely, severely negative in the front. She has navicular changes and also had venensin poisoning or exposure a while ago. She did survive it. We're very thankful for that. She had a previous flexor tendon injury as well. I want to say before I proceed with this, these people waited, so she was a little bit overdue because they waited to bring her to me. We can see a tremendous amount of sole depth underneath the tip of the coffin bone and this negative angle there, and extreme length of toe. Okay, so when I talk about the navicular, everyone knows that word, and the flexor tendon, when you look here, you can only see a shadow of the flexor tendon. It comes along, goes underneath the navicular bone, and attaches underneath the backside of the coffin bone. So when that's tipped backwards, that stresses that region and compromises the blood flow. As I stated, she was overdue because they waited to bring her. She came up from Georgia. This is the left front before and the left front after. Okay. Dome. Here's our rings that I talked about before. You can see them. This was pre and post trim, and this is the bottom of the foot. So we see she needs support all the way back to here. This foot, this heel is really, really run forward. She also, this depth all the way around the frog is our indicator. There's a lot of sole depth everywhere on this foot. And also with her frog is really long, and we see that with some of these navicular horses and some of the negative angle ones. The frog lies and extends really far forward. You see it's really close to the tip of the foot. Left hind before and after, and then over here we have right hind before and after. See this more broken back of pastern axis. Add a little artistic flair with the light on that side. Right front before the trim and right front after. So our right front is our more severe case. Huge rings. Looks like she's standing on her heel bone. Right front, now this picture and this picture are the same, so pre-trim. And then after the shoeing. So I MacGyvered that package a little bit there, which I'll show you. So she needed elevation, but this actually came in the form of a rocker and not a static wedge. That's something else. I typically go more to rock or roll. Then you get 4 degrees whether you want it or not, because it gives them some choice. But here she needed relief on the in the navicular region and the flexor tendon region. Yeah, someone call MacGyver. So this is post trim. I used a Stewart clog, and I actually took rails that go with another package, and I screwed them in the bottom. So she has load sharing across the back of the foot here. And you can see the rock, I softened the back to try to still encourage a heel first landing, but then she's got some roll in the front where she can kind of stand on it, or she can rock herself way forward if she wants to, which she loved. And here she is after the package walking around. You'd actually never even know. See some hind end weirdness there as well. She's been through a lot, this mare. So, shoeing considerations in today's market. We have barefoot, steel, aluminum, composite, nail, glue, and super glue, removable cuff shoes, casting, boots. There's so many options. I personally believe it's an exciting time to be a farrier. Some thoughts for you to consider as far as the way the shoeing world is today. These things are all tools. I try not to lend emotion to any of them. Actually, they're tools. And the beautiful thing about being a farrier is that there's a lot of different ways to do things and achieve the same result. And the important part is that we're trying to help the horse. So it's easy to lend emotion to it, but that they're all tools. No one shoe fixes everything. So online, on Facebook, on social media, and all these things, be discerning. Do your research. Where is the information coming from? Are these people professionals? Or are they just keyboard jockeys, right? Where is your information coming from? And the other thing I'll say too is if someone's trying to sell a product, it's just like anything else. I'm a little leery if someone sells something as it can fix everything, because no one shoe fixes everything and no one shoe ruins everything. But there's a place for all of this. I really believe there's a place for all of this. They're all tools. And the other thought is too, that if they wouldn't exist if it didn't work at some point. And then the mapping helps us say, all right, do I repeat this process or do I try something different? So they wouldn't exist if they didn't work on some horse at some point. To aid in your decision making, how to care for your horse. Where does the horse live? I learned this in school. Thank you, our diploma. What is the horse's job and what are the owner expectations? Those 3 things can help make decisions for both the farrier, the owner, the vet. It's a team effort. The other thing that I added to that is budget. And I don't just mean dollars. I mean time, effort, sweat equity, elbow grease, all those things. Someone might be able to afford buying boots, but they can't physically put them on and off. Someone else, may want to save money and do it a different way because they can do it themselves. There's a lot of different ways, all tools. Where does the horse live? What is their job? And what are the owner expectations? Closing thoughts. The feet affect everything. Everything affects the feet. In the cases of laminitis, by the time it shows up in the feet, it's already happened. But pasture changes, diet changes, moving, hauling, all these things, they show up in the feet, abscesses, etc. No foot, no horse does not mean bigger feet are better. It does not mean that bigger is better. Why call it therapeutic shoeing and wait until after the horse is lame to apply these principles? I tend to get pigeonholed as a therapeutic shoer. I don't look at it that way. Why can we not apply these principles to the horses to help prevent injury and call it understanding healthy hoof function and quality farrier work? So it's, why are we waiting until they're lame if we can apply these things and prevent lameness? Thank you for joining me. This was originally for people who had come in person, and the video did not save. So thank you to Dr. Hancock. This is her facility here at True North Equine in Warrenton. She hosts a monthly educational series, and also for her passion for constant education and growth. Dr. Richard Bandsman, one of my mentors, Mark Plumley, Mission Farrier School, Curtis Burns, Polyflex, Horseshoes, No Anvil. Each one of these people has contributed tremendously to my growth and why I'm here today. If I can be of any assistance to you at all, if you'd like a talk at your barn and you have any questions, like I said, Red-Headed Farrier, Dana Hall, you can pretty much search those words and find me online. Thank you for joining.